it's a year ago today that we published our introduction to what we hoped that the Lancet Commission would be achieving over the coming years of work. You don't need me to remind anybody listening to this seminar that it's been an extraordinary year in which to be trying to run a global commission. Even for those of us involved in public health as our bread and butter daily activities, I don't think that a year ago any of us would have predicted that as a commission we still have not had an opportunity to meet together. Which has been a huge loss as far as our ability to interact with each other is at a personal level is concerned, but I think has really opened up the space for thinking about new ways of communicating, not just with each other, but with everybody listening to this seminar. So just this slide is just a really quick reminder that we set up the commission with a number of core principles, that the work that we were going to do would be based around an understanding of the politics of gender and global health, something that we've heard time and again throughout the seminars is absolutely central to not only why we might not have moved forward in a way that we wanted in the past, but understanding the politics will help us move forward in the future. We set ourselves up as being explicitly feminist, globally relevant, rights-based, inclusive and intersectional. And for those of you that have been able to tune into more than one seminar, you'll have very much realized that our approach has been both multidisciplinary and to some extent multi-sectoral. We explicitly wanted to move away from the echo chamber of gender experts just talking to other gender experts and have a combination of both gender experts and subject experts. We very much want to engage with the wider community out there, of which this seminar series is part of our aim of engaging in a dialogue with people, not just disseminating the knowledge that we find through the Commission. And again, that speaks to a vision of the role of the Commission and the work of the Commission about incorporating a vision and voices from the ground up and from top down. We've set up a structure of the Commission that involves relationships between the co-chairs, the commissioners, the secretariat, who are the people who set up and organise and really run this incredible seminar series that you're all listening to. Fellows and contributors across the range of institutions and organisations that the commissioners are housed within, and of course our colleagues at the Lancet who act as the sort of lightning rod to make sure that they're keeping us all on track, and that we're trying as much as possible to keep to timelines, as well as the intellectual energy that the Lancet of course brings to the work of the Commission. So this slide just sort of is a quick reminder of the global spread of the commissioners. The little pictures that you see, you probably can't see any of us in full detail there, but each picture represents the geographical location of a commissioner. But the slide with the map with the purple colour on it just indicates the countries that commissioners actually work in or have expertise in. So although we might be confined to one country each at the moment, and we certainly are in pandemic times, the experience and the networks that we bring to the Commission are much wider than just the 20 odd countries that we currently all live and work in. One of the things that we have been really keen to do as a Commission, as I said, is to understand not just our own views and vision of gender and global health, but to engage much more widely with with different stakeholder groups and different community groups across the world. So on the right-hand side of the slide, you'll see a fantastic piece of social network analysis based on Twitter handles, as far as I remember, which really indicates how we as commissioners talk to each other within the Twitter sphere and across social media, but also shows you the different kinds of communities that each individual commissioner also engages with. And so you'll see that whilst a lot of the commissioners are networked, many of the commissioners exist as very separate networks and bring those voices and those views and those visions into the work that the commission is trying to do. And on the left-hand side of the slide, you'll see that we really, I like to think that we really did succeed in our original aim to be truly multidisciplinary and multi-sectoral in our approach. In other words, that we encompass a range of methodologies and subject areas as a group of commissioners. So we've had a fantastic set of seminars so far. We opened with Raewyn Connell talking about the epistemology of public health knowledge, being based predominantly in the paradigm of science-led, evidence-based research knowledge formation, a model that Raewyn very articulately reminded us fails to really capture the dynamics and the order of gender within and across societies. She also reminded us that this model of knowledge was created within a framework of colonialism, a system that she characterized as masculinized and that persists today and lies at the heart of some of the power inequalities we see between the global north and the global south today. And that was something that Pascal and Emma then picked up on in their seminar, reminding us that much of public health relies upon the disciplinary evidence of positivist science, but addressing gender inequalities and other inequities across society is not about taking a reductionist view of the size and scale of a problem, but understanding and addressing the deep-rooted structures and systems that perpetuate inequality. And part of this, as Pascal and Emma very clearly reminded us, involves coming to terms with the colonial nature of much of public health, again reflecting Raewyn's perspective as well. The work that Emma and Pascal presented us showed that much of the approach of decolonizing the global public health space is still situated in the stage of showing what the problem is rather than finding solutions to the problem. Decolonization provides an opportunity for a reversal of that and a space for a plurality of voices and visions. And I would say that if we replaced decolonization with gender in that sentence, that also speaks to what we're trying to do within this commission, that we're trying to move beyond the diagnosis of what the problem is and be an action-oriented, solutions-positive commission. We have very much heard from many of the commissioners about real-world examples of how communities themselves can challenge the ingrained systems of power that perpetuate, embed, and ingrain gender inequalities derived from historical inequalities, as referenced by Raewyn and Pascal and Emma, in order to really turn those inequalities on their head. Renu and Kathy, for example, drew on theories of community mobilization to address the broader social and structural inequalities. Sahaj in Gujarat, India, uses an SDG framework and a gender index to track progress at the level of the community. Community report cards can both monitor progress and hold systems to account, but it's not without its challenges, including the fact that the disenfranchised often cannot afford the costs of speaking out. Fran and her colleagues from Wominda, a community-controlled organisation for Aboriginal women and their families in Australia, talked about the importance of understanding both theory and practice to catalyse change. At Wominda, Culture, one of 4 of Bourdieu's capitals is the foundational aspect that underlies all of their work, directed towards Aboriginal ways of being, knowing and doing, seeking to decolonize the community. Seeking to decolonize means that the community has reclaimed space and power. Sorry. Elena, Gary and Morna have shown how taking a rigorous, empirical and intersectional approach to gender and health can reveal inequalities both between and within societies. Gary drew on the extensive work of the Lancet series published 2 years ago to highlight the evidence base, both of the strength of the gender health relationship and the impact of interventions that respond to gender inequalities across society. Elena provided a clear framework for thinking about gender in relation to a larger framework of inequalities across society, addressing, for example, race and class as well as gender. And Morna highlighted how taking an open mind to the empirical evidence can reveal unexpected findings. In this case, the relationship between HIV, treatment and outcomes and how they differed between men and women in South Africa. A deeper dive into that empirical evidence found that men were actually dying from violence, road traffic accidents and suicide. In other words, expanding our vision from the narrow issue in front of us, men and HIV, to look more holistically at the data, helped identify where future interventions should be situated. And finally, systems that work for everybody was the topic of the presentations, the seminars led by Sophia and Simone. Sophia outlined how a human rights-based framework can be used as a tool to both promote gender equality in health, particularly through a legal approach, although she pointed out that gender is frequently missing or inconsistent in the relevant global health treaties, treaty bodies, etc. This lack of legal clarity means governments can obfuscate their commitment. She urged us to listen to the priorities of communities themselves. Again, that recurring theme through many of the seminars, that this is not just about conversations held in academic or UN environments. This is about what communities and people on the ground actually think and want from gender equality and health equity. And that's exactly what Simone described in her talk, focusing on the medicalization of childbirth in Brazil. After outlining the horrifying impact of an approach to childbirth that focused more on the medical than the maternal, Simone highlighted the role of social movements in pushing for indicators that place women at the very core of what is being measured. I feel, sadly, we've actually lost a slide, which was the slide for that covered the work of Ben and Khadija, and I apologise profusely that slide seems to have disappeared from the slide deck. But both Ben and Khadija emphasise the importance of understanding the role of individual constructions of gender and how these interplay with the global norms and ideas of what gender equality should really look like. You can, of course, catch up with all of those seminars. They are available on a number of websites for the institutions involved in co-chairing the commission. So that is at the United Nations University for International Institute for Global Health in Kuala Lumpur, where my co-chair Pascal Alotti is based. You can find these seminar recordings at the UCL Centre for Gender and Global Health, where I'm based. And I'm not sure if my other co-chair, Asi El Haj, actually has a website, but I feel like that should probably be one of the activities of the Commission moving forward, that we have a web page for Asi as well, where you can also catch up with these seminar recordings. I'd encourage everybody to check out the past recordings, to look at the fantastic series of blogs that have been written based on the seminars. And those blogs have been pulled together by an incredibly competent team of young interns and young researchers. My final slide is my final slide would be, if I could get there. Just to remind you that this is not the end of the seminars themselves, but the seminars will now become part of a much larger program of engagement, dialogue, and conversation as we really try to push forward the boundaries of our understanding and our action on gender and global health.